Hi classmates, my name is Valerie and a host on today we'll be doing a case presentation in response to pneumonia. AD is a 67-year-old female who came into her PCP's office for having a cough of almost a week with new onset fever and increased work of breathing. She reports she has been feeling under the weather for a week now and started with cold-like symptoms that developed into a cough with difficulty breathing and being increasingly tired. However, soon after she developed a fever with chills and a productive cough. Relevant past medical history is indicative for asthma and diabetes. She reports she has had somewhat similar symptoms before during an asthma attack, but it relieves quickly after taking her inhaled corticosteroids. She reports she's tried to take her inhalers this time around, but it is not helping. Upon physical assessment, she is noted to have respiratory distress. She is having difficulty breathing and presents with a productive wet cough with sputum production of rust-colored. The presence of crackled lung sounds heard throughout. Her SATs are 90% on room air, respiratory rate of 25, heart rate of 98, and a temperature of 38.2 degrees Celsius orally. Her cardiovascular assessment indicates she is tachycardic and febrile, suggesting signs of infection. Based on the subjective and objective information, AD is presenting with hallmark signs of pneumonia. Pneumonia is clinically characterized by fever, cough, shortness of breath, and malaise, all of which are evident in her case. Furthermore, the diagnostic test that will be performed will provide further confirmation that her symptoms are associated with pneumonia. The diagnostic test I would perform would be a polymerase chain reaction or PCR swab, which tests for respiratory bacteria, a chest x-ray and blood cultures, and labs, specifically a T-cell count, CRP, and white blood cell count. The PCR nasopharyngeal swab would come back positive for Streptococcus pneumoniae, and the chest x-ray would indicate the presence of lung infiltrate suggestive of pneumonia. The CRP, T-cell count, and white blood cell count will be elevated, and the white blood cell count will indicate which cells, either neutrophils or leukocytes, will be elevated. The blood cultures would come back positive, indicating there's a bacterial infection, and along with other test results, we would be able to start the correct treatment. Treatment for pneumonia is antibiotics. Orally administered amoxicillin is the first line as an outpatient treatment, while ampicillin or penicillin is initially initiated by IV route, and it's the first line option to treat inpatients. In her case, considering she has been having these symptoms for over a week with fevers, I would initially start IV therapy followed by IV fluid and antipyretics to aid with the fever. Furthermore, I would administer oxygen to help with her symptoms of respiratory distress, such as increased work of breathing and coughing. And this is a list of the references that I used. Thank you.